Good morning, everybody. This is the Mojave County Board of Health meeting for February 26th, 2024. Madam Clerk, can I get you to do a roll call, please?
Jean Bishop,
I am here.
Hunter Adams,
I'm here.
Terry Coyle, Byron Stewart,
Here.
Robert Litz,
Here.
Nancy Montague, Cal Sheehy,
Here.
Sandra Thomas,
Here.
Dr. Nguyen,
I'm here.
and Chad Kingsley,
Present.
and Tingwei Chavez.
Recognizing that we do have quorum.
We have a quorum.
Okay, thank you for that, and we'll start this meeting out with the Pledge of Allegiance. If you'd all join me, please. I pledge allegiance to the flag
To the flag of the United States of America and to the republic
one nation
under God, indivisible, with liberty and justice for all.
Okay, we'll start out this morning with a call to the public. Is there anyone that wishes to address the board this morning? Okay, seeing none, we'll go on to the Public Health Director's report this morning. Dr. Chad.
Yes, this report all is well within the department. I do want to recognize that our WIC staff were awarded award that came with a monetary award as well for meeting their caseload and exceeding it. And I'll be sending that out to the Board of Supervisors, but just to recognize the great work that our WIC staff has been doing to meet the needs of those that are being served by the WIC services. So other than that, that's it. Thank you.
Okay. Any comments or questions? So we'll go on now to the next item. That will be to look at the Board of Health meeting minutes for January 22nd, 2024, and a motion to approve.
So moved, Litz.
Motion and second. All those in favor say aye.
Aye.
Motion passes. Next item is to acknowledge the report from the Mojave County Department of Public Health and the Kingman Regional Medical Center partnership to conduct the 2024 Community Health Needs Assessment survey administered every 3 years to identify health needs and concerns in the community. Good morning.
Good morning.
Can you give us your name and position for those viewing from the public?
Yes, thank you. Danny Lagana, Special Programs Analyst, Public Health. I realize I am here on a day that is not your regularly scheduled programming, so I have made this very brief for you guys. We will go over what we are doing with the Community Health Needs Assessment, the current status, and our next steps. So every 3 years, Kingman Regional and Mojave County Department of Public Health team up together to pool our resources and provide a community health needs assessment. And it is a requirement for KRMC as a nonprofit, but it is also a requirement for us to maintain our accreditation. We work together so we don't duplicate our services, but also make sure that we can cover more ground. The survey is open until March 31st. This is the current timeline. You can see highlighted up here. The surveys were going to begin on February 1st. We actually opened it in mid-January in hopes to get a larger response pool. In 2020, there were less than 300 responses countywide. We're hoping to get a larger response. We are now at 491, not even 10% of our population. So we're working on that very diligently. Key informant interviews were also slated for April, but those are going on now. And then As you see on this timeline, we're just going to keep on going, and from there it's focus groups. You have a press release that I created that should have been in your backup documents. That was sent to Roger Galloway and then disseminated to the news outlets, and these are the outlets that picked it up. I was also on Speak Out 2.0, and Roger and Chad talked about it on Roger's podcast. We are leveraging our partners as much as possible. We have hard copies available of the surveys in the more rural areas. They are at every single Mojave County Library branch, all of our nursing offices, the community centers in Meadview and White Hills. It does say on here that we are at Creek Valley Health Clinic and Colorado City Police Department. However, I just learned on Friday that they didn't make it there yet, but they will be there soon. I've been going out with the mobile health unit to all the areas, bringing the QR cards and the hard copy surveys, pushing the surveys there. And then with the Mojave County Street Team, both KRMC and myself attend, and we make those surveys available at those events as well. This is everywhere that we are. I'm hoping to get into more facilities outside of Kingman and Bullhead, but we do have a pretty strong presence. I will be going to laundromats and gas stations where they have the bulletin boards, and you can kind of just pin up some stuff on there, just make sure we are where the people are. And this is our next step. So as I mentioned, we're at the survey and key informant interviews. Next step, next week, actually, I'll be planning the focus group locations and getting in touch with people in the community, see who wants to kind of be a part of that. If any of you want to be a focus in the focus groups or a key informant interview, you can reach out to me and I can get you connected with the people that are working on those. And this is where we have our community health needs assessment in more detail. I can also send that to you directly, that link, if you're interested. And I have little QR cards with me today if anybody wants those as well. But that's pretty much it on the health needs assessment. Any questions?
I have a question. Are you getting a good response from the public as if you compare it to past years when we've done this needs assessment?
So
Are you
in
doing
2020,
better?
we're assuming due to COVID that there was a lack of response. We have actually bypassed that within the first month. So we're hoping that it is a better response as far as getting people to respond. But we do get some negative feedback and comment on social media. And we're just kind of the lack of relationship and communication on some of these past surveys. People aren't really sure what we're doing with the information, so there is a little distrust. So just kind of trying to make sure that they understand where this is going, what actually comes out of it, and we're just educating them on really the amazing work groups that have come out of past surveys.
Is the health van carrying information and helping
Yes.
with the survey?
Yeah, and I've actually been attending with the health van to all the units, to all the locations, and it's been great. We are able to really communicate with the people in those communities, and they get to see us and have a relationship. And then I'm like, hey, by the way, we have this survey, and they've been pretty respondent so far.
Okay, wonderful. Anyone else?
Just a quick question. On the social media, like you said, is more negative than positive. Can we use that to leverage and provide more educational opportunity?
Absolutely. I've been using that as an opportunity, providing links and giving real life examples of what has come out of the previous surveys.
Right, even a little video clip to, describe what this is for our community, that'd be great. Because
Yes.
it's pretty active. I mean, I'm, what is it, app next door or something like that. People talk a lot, and I think that's helpful.
Thank you.
And just to put a note in here, and Danny describes it well, but this is really for our community members. This is the opportunity for not to have the government to tell you what your health problem is, but for you to tell the government what your health concerns are. What do you need in your community, not the other way around. And this is what this is always an opportunity for the community members to speak up and share, this is what we need from you for us to do. So, yeah.
Okay, any other
Hey,
questions?
Danny, this is Hunter. This is
Hunter.
Hunter.
Go ahead.
I just had a quick question. So you mentioned work groups have come about through this process. Can you give other examples of resources or maybe like grant opportunities, programs, anything else that kind of comes out of this community health needs assessment?
So some of the work groups, we have the Futures Without Fear. It's a human trafficking coalition that provides education due to the increased trafficking in our county. That has come out of it. We have MSTEP that educates on opioid abuse and gives actual children and adults the opportunity to get their charges decreased if they go through certain education. Excuse me. As far as grants, I don't have answers on that, but I can look into that and get back to you.
Thank you.
And to put in that, this community health and needs assessment when it comes out is something that any nonprofit within our community can use to, when they go to write a grant, to say that, in the 2022 health assessment presented by the Mojave County Department of Public Health, it lists lung cancer as the #1 cancer, or, if they're going after certain grants and stuff, they're able to take this and use it. So it's also a tool that's available to county nonprofits and organizations out there for them to use when they apply to a grant. So very useful tool for them too. So.
Okay, and do you have an approximate date for when this assessment will be complete and available to the public?
The surveys will be done on March 31st, and then through April, we'll work on the finished key informant interviews, and then through end of May, we'll do the focus groups, compile all of that information and data, and the KRMC is actually charged with that portion of it, and then they'll get it out, and we're hoping maybe June, early July.
Okay, thank you very
And-
much.
And just one quick last question. This is Sandra Thomas.
Sure, Sandra, go ahead.
When these individuals take the survey, they consent to participate, do you provide information about when the results will be so that they can access those?
So I don't know if in the past, I'm fairly new to this position, so I can't speak to how it was done in the past, but I am absolutely working on a campaign where I'm communicating throughout the process, but also when it's complete, and make sure that everyone has access to that. So if I shared on Facebook group pages, hey, there's this survey, I'm going to go back to those same groups and say, guess what, here's your surveys, thank you for your responses.
Fantastic. Thank you.
You're welcome.
Thank you very much for your presentation.
Thank you.
Okay, we will now go on to the next action agenda item. This will be the review of the Board of...
Madam Chair,
Yes.
on the agenda is acknowledge the report. I don't know if you want to make a motion to acknowledge the report, or just this is just
I don't think there's
information.
any action that's necessary on,
Okay, this is just information, actually.
Right, just for
Okay.
information.
All right, thank you.
okay, we're going on now to the request from the Board of Supervisors for more information. This will be to recommend a course of action to the board regarding the offering of parents an option to space out of the administration of vaccinations when a child is recommended to receive multiple vaccines during a nursing division childhood vaccination clinic visit. That's quite a mouthful. What does that mean in layman's term?
So, so our presentation will be, the Board of Supervisors had asked to convene this, to take this subject that was discussed previously in the Board of Supervisors, to bring it to the Board of Health, provide the information that we've researched, and try to provide the information to the questions that were asked, provide it to the Board of Health, and have your input to be brought back to the Board of Supervisors. So this is what our presentation day will compose of the information that we've gone and researched from different aspects to try to more comprehensively answer this question, as well as for our community members, but as well for the Board of Supervisors.
So this is going to go over what's required, what's actually required, and how do we make this work effectively for parents of children?
Yes.
Okay.
So I think we'll go ahead and present. I'll be presenting, as well as Lynn Valentine, our Nursing Services Manager, on these 2 points. I believe a lot of things will be able to answer some questions, but also bring up those points that you as Board of Health members will be able to decide what's to weigh in and your input on the community. So we'll go through the presentation, and then we'll open it up for discussion and discussion among the Board of Health members, if that's okay.
Okay, the floor is yours.
All right, thank you. So this is the Board of Directive, have the Board of Health review a 6-month vaccination schedule and analyze the offering of an alternative prolonged schedule. Questions that arose during the Board of Supervisors meeting was, what is the vaccination clinic program? How is Mojave County Department of Public Health handling it? Why are the vaccines bunched up? Are they too much for the size weight of a 6-month infant? Are flu and COVID required? And can Mojave County Department of Public Health spread it out? under the funding agreement with the state. So those are the questions that were part of the discussion. So overall, this came apart for part. This is the case, a single case. I'd just briefly be able to present on it, but it was a parent guardian presented voluntary to the Lake Havasu Center, Mojave County Department of Public Health vaccination clinic for their child, who was administered age-recommended vaccinations, and also as well as the COVID and flu vaccine. The parent reports continued recommendations for full. The parent reported that continued or persistent recommendations for full recommended coverage to the parent. That afternoon, evening, or night, the child was brought to the Lake Havasu Medical Regional Center. There is no NICU or neonatal specialist, and then was transported to a Phoenix Child's Hospital for care. The child was released to home care the next day. And then overall, the basics just for a case review, patient, actual age, so it's not unknown these specifics. It was just presented to us on this matter, but age, gender, weight, medical history, and labor delivery are not available for the case study. Symptoms, what we have is reported as a fever with possible febrile seizures due to the fever, and then documented hospital case notes. We don't have those, but there's just an overview of a patient coming in and having an adverse reaction to the 6-month vaccinations that the child received.
Dr. Kinsley, what is a febrile seizure?
So a lot of times, so it is a seizure, but usually anyone that receives a fever over 102 has when you read about 102 or above, the body responds to a type of reset in a sense. So the brain can cause, the fever, the heat of it will cause a seizure. It's not an epileptic seizure, but it's a type of seizure that the body, due to the heat that is being caused on within the brain and the nervous system, to cause a response. Sometimes it's harder to identify. It can be seen sometimes as to describe somebody that gets a high fever, they start to get chills and they start to shake uncontrollably. So sometimes those are sometimes confused for febrile seizures, but as well as there is an actual seizure that can occur within the brain. You usually really start seeing 104, 105. Dr. Nguyen, did you have any other input on that, I would say?
Right, you're correct. And actually commonly seen in pediatric population than adult. So yeah, and the best approach is to bring the child to the healthcare provider to control the seizures if needed to with medication, or in general just a cooling down. Take care of the temperature, that would help improve that symptom.
Yep.
And hopefully you have the rest of the course of the hospital course, if any follow through from the Children's Hospital Phoenix.
Okay. Did I answer your question?
Yes.
Thank you. Okay. So just a little bit of a basis here. So standard practice of care. The medical standard of care refers to the type of care that our reasonably skilled and competent medical provider with a similar level of education within the same area would have provided to a patient under the same treatment circumstances. So today when we speak about what's a standard practice of care for vaccination, this is just a basic definition for it. So if it were to go to a court or stand in it, what's the standard practice of care for vaccinations throughout our state and throughout our country? With that said, the Arizona Administration Code R96702 is where the requirements for vaccinations are enshrined. And documentary proof of immunization for each of the following diseases is required for child care. So that means that daycare or when school entry. So usually daycare, some daycares will accept infants. A lot of times they do begin around 6 months though. For that. But what is required in Arizona law is diphtheria, tetanus, pertussis, hepatitis A for a child 1 through 5 years of, and that's just in Maricopa, but that's in their law. Hepatitis B, poliomyelitis, measles, mumps, rubella, Haemophilus influenza type B, and for a child of 2 months through 59 years of age for that's for them. And then varicella, which is chickenpox, and meningococcal disease. So those are the ones that are enshrined in law that we are required or that are required for daycare or for childcare and then school entry. And they're part of a schedule at certain times. There's different dosages. So usually some have 3 series of dose that usually the first dose that people, is like 92%, next one will take them to 95, the next one will take them to 98%. And they're administered at different times according to the immune system that allows them, the immune system, to remember that infection. But these are the ones that are required onto that. So COVID and flu are not required, part of the regimen. They are only recommended. But these are the ones, if you go to school and if someone chooses not to be vaccinated, they would have to sign a waiver at school saying that I've chosen to opt out of these, and it's my responsibility as a parent that I'm choosing this. So it's a waiver that they can have to go to school, but they do have to do a waiver. So there's a quick review over this, but at the 6-month review, so you have diphtheria, what we call DTaP, but pertussis, diphtheria, and tetanus, and the Haemophilus B influenza. And both of those are the third dosage of that. And then recommended at 6 months is RSV only if the mother has not had the immunization for RSV, because she will transmit the immunity to her child through breastfeeding. So there's just a healthcare provider will weigh in on that. But the other recommendation ones that are not required, but are rotavirus, pneumococcal conjugate, COVID-19, and the flu vaccine influenza. So those are also recommended there at the 6 month, but the only ones that are required at the 6 months are the Tdap and the Haemophilus B, and those are the third dosages. The ones that are from, the ones above are set out through a schedule, but required from the 2 to 18 months during that time. So at this time, I'm going to turn it over to Lynn Valentine to kind of walk you through the throughput process of if a person coming into to receive immunizations.
Good morning.
Good morning.
So what we have here is our flow chart of what it looks like when a parent brings their child to one of our childhood immunization clinics. So obviously it starts with the parent arriving for the appointment. We do vaccines on appointment basis. When they arrive, if we haven't already collected their child's immunization record, we collect it at that time, but we provide them with the client intake, and I believe you all had these in the backup materials, but I can put them up here on the camera too. But we provide them with our client intake form, which collects the child's demographics and insurance information and whatnot. Oops, that looks like it's upside down. That's what that looks like, and they sign down here at the bottom. And they also receive our patient screening form, and that gives us a little information on the child's health status, on their vaccine status, and some other relevant information. So they complete those. They obviously turn those documents into our front desk person. Based on that information and looking at their vaccine record, then the front desk person can, and their age, can determine what that child is due for or what would be recommended based on the CDC recommendations. So at that time, the parent is then given this document, which is our consent for vaccinations. On here, whoops, I keep doing that, sorry. On here is where the recommended vaccine for that child, vaccines are marked off. And then with each one that is marked off that's recommended for that child, the parent also receives copies of the vaccine information statements for each one. So if this child was recommended to get the DTaP, the diphtheria, tetanus, and pertussis vaccine, they would get this document to review, which has extensive information about the vaccine, including risks, and there's the vaccine adverse reaction information, how to report an adverse reaction. They might be getting several of these. If they were also recommended to get the pneumococcal vaccine, they would get this one, and so on and so forth. So they might receive several of them at one time. Okay, so there is a lot of information, but it is provided to them. From that point, once they're given all the information and explained what the recommendation is for that child, then this is where the parent can decide which vaccinations they would like their child to receive. We don't tell them, we just say, this is based on what the information you've given us. These are the vaccinations that your child is recommended to receive at this time. They make the decision whether they'd like to refuse some vaccines, and we do have that happen. And if so, they are asked to complete this document, or refuse to vaccinate, and that just marks off which vaccines that they have declined, and which ones were recommended and which ones they declined. They do fill out that form and sign it at the bottom. So we do have record. And if you notice, it's on bright orange too, so that the nurse can easily see if there is a declined vaccine when that child comes back to the clinic room. So it's very easy to spot if there is a refusal form. Otherwise, if they agree to all of the vaccines that were recommended, excuse me, then we move forward with the appointment. Obviously, next, once they've decided which vaccines they'd like to decline, if any, and which ones they'd like for their child to receive. And sometimes, like, you know, I explained it at the Board of Supervisors too. Sometimes we do have parents who ask, can I spread these out? I just want him or her to get a couple today. And we absolutely, we will support that. And we do that. And sometimes we have people who just want to have their child get the ones that are required for school entrance. And that's fine. And we completely support that. And that's what we do. The parent is in control. So then they go back to our clinic room with our nurse. And when they're back in the clinic room, then again, they are given the opportunity to ask any questions that they may have or any concerns. And our nurses are highly trained on vaccines and vaccine administration and can answer the questions or concerns that the parent may have. And the parent is also told once again what their child will be receiving, and they have the opportunity up until that shot is being administered, they have the opportunity to opt out. If the parent, and this happens sometimes too, if the parent gets in the clinic room and decides they don't want their child to have COVID, the COVID shot or any other of the other vaccinations, they can opt out. That's absolutely possible, and it does happen. So they go back there, they're given the information, the nurse reviews the patient information and with the parent, and as long as everybody is in agreement to move forward, then the vaccines are administered. And then the parent and the child obviously leave the clinic. Before they leave, they are provided what we call our aftercare sheet. And that is a document that they take with them that tells them which vaccines their child received, and then just what to do if that child has some side effects or adverse reactions and what they can do about that and when to call their provider. It also has some other information on the back, like the vaccination schedule, and then some other links for further information about vaccines. But that's our basic clinic flow, and it's been in place for many, many years. And once again, we are there to support the parent and to do what the parent decides, but we do follow the CDC recommendations, and that is what we recommend to all of our patients. Are there any questions about that?
Yes, I have a question. The situation that Supervisor Gold brought to light, have we identified who the county employee, the nurse was that supposedly aggressively dealt with the parent of a child that had a reaction?
I have been sitting in with the clinics at our different sites, and I will continue to do so. But we do know which employees were involved on that day. As I had mentioned, that's not our standard practice. So I don't know. Yeah, I do know who the employees were. And yes, I have spoken with the employees. And we have just reiterated what our standard practice is and that we will always stick to, letting the parent decide, that we don't make the decision.
Okay, and then if a child has been exposed to, say, measles and actually received the experience of that, of actually getting measles, do they then need a vaccine as well later? Or is that an immunity that the body just has naturally?
They would be immune. Yeah, they would likely be immune if they already, it's different for different diseases, but for measles specifically, most likely they wouldn't need a vaccination because they would already have that immunity.
I bring up measles because that's in the news now. There were some,
Yes.
a few cases in Phoenix and then even more in Florida. So, with the influx of
Yes.
immigrants coming into our country, we're starting to see some of these childhood diseases come back. So
Yes.
are there others like that you can develop a natural immunity to, like mumps?
Yes, absolutely. Chicken pox.
Right.
There are, the flu, obviously, we know there's different strains. So just because a person gets flu once doesn't mean they're immune to all strains. So that would be an example. But there are some diseases where you get natural immunity and then you wouldn't need the vaccine.
So that would be legitimate reasons to opt out.
If they already had absolutely, and there always are. There are always contraindications that we are always screening for and asking about that tell us that a child or a person is not, this vaccine would not be recommended for them.
Okay, and then children are not kept from going to public school if they have not had their immunizations. They just have to sign a form. Is that correct?
That's correct. In the state of Arizona, we do have personal belief exemptions that a parent can document, or a medical exemption, but more often than not, they do complete the personal beliefs exemption.
Okay, and then my last and final question is, I wonder what that was. Gosh, and it was a good one too. So I'll go on to everyone else, and while I remember what I forgot there.
I have a question, Lynn.
Yes.
On this particular case with the mother who, on this incident that was talked about at the board meeting, it appears, I understand this is second, third-hand information and all the facts not be known, but it appeared that the person at the front desk was asked 3 times about the option of declining, I guess, the combination shot, I suppose, and was essentially, based on the version that was presented at the board, was talked into it by the person at the front desk. And I believe that the mother stated that she just didn't want to argue it anymore. And so apparently when she went back with the nurses and was offered the opportunity to raise the issue, she did not, which, maybe a young mother, I could see where she could be intimidated to where she doesn't want to raise it again. So I was just wondering if it might be part of the procedure for front desk. So if a parent indicated a real reluctance to get the combination shot in terms of being asked 3 times, if the front desk person could communicate that to the nurse before the mother went back there, so the nurse would be aware that that issue had been raised at the front desk, but might not have been, the parent may not have wanted to raise it with the nurse. So if just an increase in communication, so maybe you would know what the situation was.
Absolutely. Yeah, absolutely. And we do have our front desk and our nurses communicating. So if there was something that occurred before that parent got back into the clinic room, that front desk person would be and should be communicating with the nurse. But again, at no point during their visit should any parent feel pressured to get any vaccine for their child. They make the decision.
Okay, thank you.
The question I had was, how long do we keep the records of these immunizations? Is
I
that in
believe-
statute anywhere, or is that a
definitely.
recommended?
Yes, I believe we keep them until they're 18 and then, is it 7 years? Until they're 24 years old. There we go, until
Oh.
they're 24 years old.
Okay, so I'm assuming that you digitize these and keep them in a file folder.
We have them electronically stored. We have some of them as paper, and they're also captured in the Arizona State Immunization Database, which is kept up forever, indefinitely.
Okay, Doctor?
Yeah, I think this case kind of bring up a good points for the vaccination and our workflow. I have a couple of questions. In our workflow, what is the primary care provider line of communication that we have? Because ultimately, every child should have a primary care provider. We are providing a vaccination to support the client and the citizen of the county. So I highly recommend that these vaccination records need to be reported fax or email to the primary care provider, and have primary care provider work closely with the family to reassure that there is just not one-way communication, not forced. You know, it's sensitive topic, so a lot of time it's how we approach. You know, a good day, you know, staff might be busy and they're not thinking about it, to take care of our client, take care of the patient. Currently, do we have any process where the primary care provider need to get that record or have a ability to get that record?
We do input those into the Arizona State Immunization Database, which I would say all or most of our providers, especially our pediatric providers, do access.
Great.
And then also we give them a copy of their updated vaccination record so that they have it and they can
Right.
take it to
Yeah.
their provider.
So reinforce that, because ultimately, the exemption comes from the personal belief, but also from medical exemption.
Right.
The primary care provider allowed to have the exemption in our state. So that's one thought that would help. And this brings back a point where I see that it could be happening, and now it's happening, is we don't have a lot of pediatric inpatient support for our community. All of the hospital, none of the hospital have pediatric support. You know, if any one of us, I myself included, have a child that needs help, they have to go to either Phoenix or Sunrise Hospital in Vegas. So that is one of the weakness of this case show up. You know, the parents already stressed and came to the hospital where the service not be able to provide at the local community level, and that's where they have to go to far away Phoenix Hospital, and that add on to the burden. So hopefully with this experience, hopefully some of the hospital have at least some basic support, you know, and we don't have the detail of the case. However, if we could find out, you know, what, for us as a scientist, we learn from our, you know, incidents. So hopefully we can learn from this case and see what that is. Is this a vaccination side effect commonly seen, or how the child was treated? So that's what I have in terms of what I see.
So, Melissa, I'm curious as to what the percentage is of these young patients that are children. Do they have primary care providers as a rule?
You know, I don't know. I would say, you know, okay, most, and I keep deferring to one of our nurses who's been one of our clinic nurses for years and truly is a subject matter expert on the vaccinations for children. But
The reason I ask that is, you know, most of my communities are rural, and a lot of the adults don't have a primary care physician,
Right. Yeah.
nor can they even find one. So I was
Right.
just wondering if it's different for children. Is it easier to get a primary care provider for a child versus an adult?
I believe basics needs for the child's up to the age of 18, they allowed to have insurance like access to support the medical need. You know, you can help me verify that, but that's my understanding.
I would just go ahead and add in too that with our current situation in Arizona, so private providers have withdrawn from providing vaccines. So increasing the number of our if they do not use their vaccine, they're penalized financially for not using it. And it has become a kind of a complicated system for them. So many of them have withdrawn from that. So many of the private providers, the only option they have, if they're pediatric, is to send these patients to our clinics or to an access or a clinic like Borders, what's the name of the North Country, or Office for Border Health. Both of them accept access. And since they accept access, they have the vaccines for children or for adults. They have better access to it than a private provider. So we are seeing that within our state across the board, that vaccines at private providers are not being provided, and they're sending them to the health districts for that. And it's one bureaucratic complication that the state is seeking to address. We have seen our numbers go up in our clinic, probably for those reasons. But it's also been general practice too. I know even as I was a child, the doctor said, you know what, go to the health district. They go through it so quickly. It turns over quickly and they have it, and it's just a good resource to go to. And also the nurses can spend more time with patients than a private care, or sometimes healthcare providers. The nurses are so matter experts, they can take the time and speak about each vaccine with the patient, where sometimes in a busy private provider, they might not have that opportunity or time to provide that information. So just wanted to do that. There was also, just for Lynn, also, if you'll read into the record, there's 2 questions from Member Coyle, who cannot be present today, but he submitted 2 questions also to be asked. So if you want to go ahead and read them and then answer them.
Okay, yes, I will do that. Okay, so the first question,
And the questions are from who?
Terry
Coyle.
Okay.
Coyle.
You want to go ahead and read that in? So Member Coyle from Bullhead City.
Member Coyle from Bullhead City asks regarding the immune screening question. Question 1, take temperature versus just asking if the child is sick. I do understand the logistics of rescheduling, but the same point will be made if the parent answers the question, yes, my child is sick. I believe that we do ask if the child is sick, because a moderate illness, or if a child has a fever, we do want to defer the vaccines for that day and wait until they are better. So that is we don't want to administer a vaccine when a child is ill. So I believe that's the question. If the child is sick, do we defer the vaccine on that day? And yes, we do. We have them come back when the child is better.
And I think he's asking as well, do you take the temperature?
We don't on a regular basis. If the parent believes the child may have a fever or is sick, then the nurse can opt to take the temperature. But it is not a regular practice. That's not a regular practice for immunization clinics in general. Question 2. Will parents understand that sheet 2 is the explanations for sheet 1? Maybe have the nurse make a quick reference of this point. Will parents understand that sheet 2 is explanations for? So I believe he is asking if the vaccine information statements, the documents that tell about each vaccine, if those are in reference to the recommended vaccines, and they are presented at the same time to the parent. We say this is what their child is recommended to get today, and the front office person at that point will go through each sheet and say he or she is recommended for a flu shot or whatever the vaccine may be. So I believe that is what is being asked there as well. Timing of vaccinations, this looks like another question. I think the timing of the COVID and flu vaccinations could be done on alternate days of the MMR or DPT vaccinations. If a parent chooses that, we absolutely can do that. And I think the last thing is statement is not a question. So hopefully I answered his questions appropriately.
Okay, other than this case that we're all aware of that brought this to light, have we had any other adverse reactions from any children from the vaccine clinics that we put on for, say, the last several years?
Well, it's not uncommon for a child to have side effects. Those are expected. It's not, we don't typically have parents calling us to tell us, I'm not saying it doesn't happen, but we don't have parents who call us and tell us that their child had an adverse reaction. We do have parents who will come into the clinic and say, oh, you know, he had this shot when he was 2 and had a seizure, or whatever the case may be. So they will tell us that they may have had them before, but we don't typically get calls after we have a vaccination clinic reporting that a child has had a major adverse reaction.
Okay. I don't have any
Quick-
further questions. Does anyone on the phone?
I do. Just 2 quick questions. This is
Is this
Sandra
Ms.
Thomas. Thank
Okay,
you, Jean.
go ahead.
Quick question on your backup material. There is a form called Screening Checklist for Contradictions to Vaccines for Children and Teens. When is that form used?
That is given to them with each visit.
Right, so this parent filled this out, right?
Absolutely, yes.
So it asks you on that form, is the child sick today?
Correct, yes. And
So
if
the nurse reviews this form before she sees the child, correct?
Absolutely, yes. And if they have anything marked like that, then the nurse will review that question with the parent to get more information.
Excellent. Second question, regarding quantitative data, do you numerically report how many children were in the clinic that day receiving vaccines, that month, that year?
We do have access to that data. I don't have it for that specific clinic, but yes, we can always retrieve those numbers.
I'm surprised nobody's asked us that question regarding this specific case, because maybe the clinic was very busy, maybe it wasn't, but that could all be factors concerning how that child or how that parent was treated or how they felt they were treated. Thank you.
Thank you.
So Melissa, that may be good information to bring to the Board of Supervisors in case that question comes up then.
We can do that.
Indeed.
Thank you.
Thank you, Sandra.
So, thank you, Lynn. Oh, that one's mine, I guess. So there we go. Thanks. So to complete a kind of comprehensive review over other questions, and we'll take those points and bring those back, and those points that you've identified, we'll also explore those and present them to the Board of Supervisors. Then just a general discussion and some points that we've looked up first. So when speaking, just a basis for discussion, understanding why we do vaccines. And vaccines is really where public health came from. It started even back with, it's reported historically with the Tsar of Russia, Catherine, with smallpox, self-immunization and stuff. It started a long time ago. Vaccines are the most researched and studied medication and treatment out there. It's been the longest one running. It has the most studies to it. It is constantly studied. It is very well known. But when speaking about vaccines, there's an economic impact. And this economic impact has affected the United States since we really, in the 50s and from there forward, where we've eradicated some disease such as measles. We technically have eradicated it here in the United States, and now we're seeing a resurgence of it. It is out there in the world. But understanding when a child is sick, sometimes a parent doesn't go to work. That's a sick day. That's a loss of that. Or if a child is sick, they don't go to school. That's a loss of education as well. These vaccines allow us to have less sick days and also benefit our community economically. Also, when we have more severe disease, we want to prevent that because then it becomes a burden on our healthcare system. And we know right now our healthcare system is costly and has many challenges. So if we can prevent that, and not only that, our ERs that can really, we're always focusing on how can we reduce somebody presenting to the emergency room to cut down costs and also prevent overspending and also the burden that comes with an ER visit. So vaccines is part of our community. It's part of its importance of helping us have economic stability as well as for our families and for mothers and fathers and who are taking care of children. So there's an important component to that. Longevity as well. All right, we have, because of vaccines, we've been able to live longer and more healthier lives. And again, I mentioned the evidence. And then as travel, it's allowed us to travel, but also in recognizing that while this is not a vaccine preventable disease, but Nevada just put out that they are the highest percentage of tuberculosis in the last 40 years. We ourselves here in Mojave County had an incident with tuberculosis. So we are just a car ride away, Mojave County. We're sandwiched between Phoenix and Las Vegas. So a lot of times 6 months later, what is occurring there will occur here. But travel as well is that we have, because of our economic stability, we've been able to travel. So we are also exposing ourselves, not only immigration, but we also expose ourselves to many diseases that we are vaccinated against when we do travel. And to help, it is a heated topic. I understand COVID-19 brought a lot of concerns about vaccines. And there is that statement. And just like that, everyone is now an expert on XYZ. Right, everyone kind of has, and a lot of that is evidence-based, kind of what they have experienced. And speaking about the immune system, it is a challenge because it's not something necessarily seen, it's something experienced. But also, when we're vaccinated, a lot of times we don't have that disease. We might actually be exposed to it, get it, and not have any symptoms because we have the immunity. So a lot of times we don't know when our vaccines are actually working for us. But I would just say when discussing this, and for the public or anything to the effect that, remember, let's take a step back and be able to take a moment and really research, seek out those sources that provide us correct information that is scientifically and evidence-based to be able to help us be able to better understand. And also just to say, we don't know everything about the immune system. We know a lot, but there's so much more we have to discover. There's a good analogy that many times when we speak about vaccines or any type of treatment is that, I put bad gas in my car, then I got a flat tire. And then can we blame that flat tire on the gas? And then sometimes we can't. There's a situation. Now, in this situation, yes, we do see an adverse reaction, but we do see sometimes a slight fever or redness at the site, but that's expected. No, if you were not vaccinated and you got chicken pox, you're expecting to have immune reaction. That's telling you that because I have that immune reaction, then I'm now immune to it. Any adult prior to 1957 is considered immune to measles because they were exposed or had measles. And so yes, having the disease does provide immunity on many points. So just remembering that sometimes, yes, we receive these vaccines, and there is a risk, just like any medical treatment, but the risk provide that economic, that longevity, and what has helped us to flourish as communities, and not only that, in our education. So this is a risk reduction and on those points. So I just wanted to kind of create that basis, and I realized that we can have discussions about this, and this is the correct forum. This is a great forum, and the input that's providing that we can take back to the Board of Supervisors. And I would say, just from the health perspective, we appreciate this. And we want to be fully transparent as public health. We want to work with our communities. We all want to feel that, yes, we are benefiting and doing the correct thing for our families and our children. So with that said, there is some information I just wanted to provide. So it's called VAERS, but it's the Vaccine Adverse, now remembering what this is, Vaccine Adverse, what's the E? Oh, event reporting. So this is where across the nation, if any event happens and anyone is open, a parent can report. Providers are expected that if a child came in and said that I just got a vaccination, they have this high fever or a febrile seizure or anything, then that provider is expected to report. There's some challenges with that, but just saying that, some disclaimers. So VAERS cannot determine if a vaccine caused an adverse event, but can determine if further investigation is needed. What that means is that, so many times they can't tell you, so this patient had received numerous vaccines. Could that, even presenting at a hospital, that physician cannot say which vaccine it was, just that there was an adverse reaction. So there's challenges to this because they know exactly. Also, sometimes there's infections that child may appear well, but they may have an ear infection, or they might just be having infection, haven't developed a fever yet. So sometimes you can't always say, well, was it that? Was it that? And so there's doubt, or a provider cannot say 100% or even in the 90% that I know this was the reaction. It just occurred at the same time. Yes, most likely, but they can't always tell you which one it was. So that's why there's some challenges with reporting. And so what it will do, VAERS, is that when they start seeing trends like the MMR at 12 months, they start administering MMR, and suddenly they see all these reactions occurring at the same time, then that's a trend, and that needs to be investigated. An adverse reaction is expected, but it's nothing high numbers. That's just, okay, we're expecting that, but it doesn't look like anything we need to investigate. And so VAERS also can't determine the rates of adverse. As mentioned by Lynn, is that, anytime we have parents that come back in, and many parents will say, they received it, they had a mild fever last time, but that was about it. That was an adverse reaction. It wasn't reported, but it occurred. So we hear about it post. So it's not the best system. It's really there to help us try to identify and collect where we can. But looking at those numbers from VAERS and pulling those numbers, cases of vaccine preventable illness in Mojave County from 2019 to 2003, and this is less than, so pediatric cases less than age 18. We had 1 Haemophilus B incidents, 2 mumps, 21 pertussis, and 11 varicella reported. There could have been more, but these were the ones that were reported. So during those times, so those are the numbers we had in Mojave County reported through the VAERS system. VAERS in Arizona in 2023, we had 301 cases. Now, this is our whole population in Arizona, just not Mojave County. So 301 children out of one, and so also adults had reactions. So 1,677 reactions. We had more reaction in adults than in children, but 301 in 2023. And then, again, all over Arizona, adverse event more severe. What was the severe that happened in all of Arizona? There were 66 cases among all those children that received vaccines. There was 1 death. There was 1 life-threatening experience. There were 2 that were hospitalized, 11 that reported in the ER, and then 43 at their healthcare providers in their office. So of those 66 events there that occurred, that was the more severe outcome that we saw just in 2023. None of those occurred in Mojave County that we can see, so it happened elsewhere in Arizona that I can see. I can't 100% say that's sure, but I know there wasn't a death or life-threatening that reported here within our county. And then for the VAERS adverse event reports for the number of vaccine administered in 2023, and this is where it gets interesting. That's why I say sometimes, so the question came up, we give so many vaccines to our children all at once. They're getting the flu, the COVID, if it's 6 months, they get the Hib and they get the pertussis, the 3, and they are the combination. DTaP is 3 vaccines put together in one, so they're receiving sometimes 7, 8 vaccines at once. The weight of the child, is this appropriate to give so many at that time, and us extending it out. What VAERS shows, when only 1 vaccine is given, the chance of having an adverse reaction is the highest. There were 70 in 2023. When a child that received just 1 vaccine, there were 70. Then a child that received 2 vaccines, there were 28. When a child received 3 vaccines, there were 14. When they received 4, 7, and then 5, 6, 7, or 8 vaccines at one time, there was only 1 adverse reaction. So what's actually showing us here is that those children that receive multiple vaccines have less chance of an adverse reaction than actually a child receiving just 1, which is interesting. We would think it was the opposite, that we're giving so many. It's not how the immune system works, really. Sometimes we are assaulted every single day with our immune system. So that's why I say sometimes let's take a precautionary, yes, this is what we've experienced, but is that actually what's occurring within our immune system? And so, but what we see in the adverse reaction is that's the opposite of what we see. So when they receive just 1 vaccine, so this is a possible point of discussion, is that if we change the vaccine schedule where we only provide 1 vaccine at a time every 2 weeks or every 1 month, we could be increasing the number of adverse reactions that we have. That's a possibility. But we would begin to conduct our own study on that. We're testing suddenly. That is not the standard care of practice. When those on VAERS, when it did occur, 39% occurred on the same day. 9% were 3 vax or more, so it was less, and 50% of those children that were 11 years and older. So even more so, it was less among the infant and younger population. It was children 11 and older that actually had more of the adverse reactions. and 46 of them did not present for further care. So those are some of the numbers comparing over. I would say that the reason I didn't completely bring up, how many we've done in Mohave County, but we will, is it puts us in a precarious situation, I would say, as a department, is, I never want to diminish that, yes, it was only one case, but I don't want to diminish the importance of that parent and the experience they had. I don't want to put them down to a number, but unfortunately we do have to talk about numbers. If we're looking at the whole state, we have minimal reactions when it comes down to it. And it's unfortunate when these adverse reactions come down, and even that one death. But it's an important risk that we have for our community and our stability of our communities. So it's just those challenges. I don't want to diminish the experience of a parent by putting them down to a 0.0007% chance of an adverse reaction among all our children in Arizona. But if that's where we're at, we need to discuss it, we can. But just wanted to give that up. And sorry, this did not translate well. So one thing was asked about was, would this affect? We have a 5-year contract with Arizona Department of Health Services that primarily pay. So these vaccines that are required, any citizen that shows up to the Mohave County Department of Public Health and asks for those required vaccines, we are required to give it. That means we have to pay for it. So it is part of our budget. That budget is covered through a grant that's received from a federal grant that's given to ADHS and given to us. It does not come from our general fund. If we were to lose that contract, then the county would be responsible to be paying for it. We contacted ADHS. There would be no loss of contract if we did extend it out. So, and it goes along with the parents, because a parent can come in and decide, I'm just going to do one vaccine today. And so we wouldn't lose our contract over that too as well. The county, they also said that if the county decided to move and change a different type of schedule, they would work with us. We would not lose our contract. So our budget for paying for those vaccines is not in threat over this discussion. Next, though, we did contact the Arizona County Insurance Pool, and I'm going to go and read this into the record here. And this is the insurance. So every county is covered by insurance for liability reasons if we are sued or put in that. And part of my responsibility is to protect Mohave County in those interests. And this was their response. And I'm sorry, this is kind of covered up here, and this is often referred to as ACIP. From a liability exposure standpoint, it could pose an issue to present local guidance that varies widely from the CDC guidelines. However, I'm sure there's a way to take a balanced approach to the subject that limits local liability by perhaps offering the CDC recommendations while also acknowledging that parents, guardian, caretakers have ultimate freedom of choice to make the best decisions for their children in their care. As you've said, these services being delivered are entirely voluntary, in that the public is requesting them and therefore can decide for themselves how best to proceed when presented with the options. In closing, I wouldn't recommend discarding or establishing your own guidelines that conflict with the CDC recommendations, but rather emphasizing individual choice is encouraged here. That is from ACIP, the Arizona County Insurance Pool. So way to help explain it, to kind of put that in layman terms, we decide that at the 6th month, we're going to extend those out. So the Haemophilus B, we're going to put it off for 2 months. We're just going to administer this one vaccine at 6 months, and we'll put it off. And then before they receive that vaccine, that child comes in, or that child then gets Haemophilus B, and either has a very severe reaction, which could cause a debilitating illness the rest of their life, or perishes. Then would the county be under liability? Because we went against the standard care. And so in a court of law, they say, well, what's the standard of care? Well, you broke that. The rest of the nation is doing that. So does that put us at risk? I would say yes, that's something that has to be discussed. I'm not trying to weigh anything else. I'm just trying to present all the information to you so you have that to weigh into your decision. And this is what the Arizona County of Insurance Pool replied for us. Next, I just want to point out, so parental rights and responsibilities. This is voluntary. We don't go out in the streets. We don't bring people in by force. They come to us. They set the appointments. They walk into our clinic. Parents have a responsibility. I know it's a lot of information to read on that. Just like when we open up any medication, we have a long list of information that comes. When you go to your pharmacy in that brown bag and they staple on that paperwork on the outside, all those same things that we do, are there present? Do we read those? A lot of times we do not. And a lot of times we do take that's where the pharmacist or our nurses come in, and they really point out what's your responsibility, what's the risk you have here. And we do that, and our nurses are very capable, and they do that, but there is a responsibility for a parent to be informed and to study. Ultimately, this is a parent's choice, what they feel. Are parental rights at risk with this discussion? They are not. I feel with Arizona law, they're very enshrined. They have the waivers for their personal choice and to ensure education. The one point I will say that it is Arizona law. When anybody signs a waiver at school, so say there's a measles case that presents at one of our schools here, by law, I'm required that any child that is a waiver, that they are not allowed to return to school for 21 days. It protects them and it protects anybody else. So that's a reality that a parent is also taking responsibility for, that if there is an outbreak at school and they have signed a waiver, that they will have to care for their child and educate them during those 21 days. That's in Arizona law. That's something that can be addressed, but that is a point. There is points for that. So if we saw a measles or a mumps outbreak, that would something that a school would have to do. And so we are establishing and have established relationships with schools and their boards so that they maintain an active list of that waivers, that we will be able to issue a letter if there is any type of exposure. But again, our parental rights at risk in the discussion, they are not. And I feel they're very protected within our laws as well as in our county, and respected by our nurses and our services. So this is wrapping it up, but just considerations. So again, I touched on this based on the VAERS number. Increased number of interventions means increased risk. If we space it out, we're taking one event and we're making it 4 or 5. That's 5 different injections, instead at different times. You are going to increase the number, irregardless of that. It's a possible, you're increasing the risk of the possibility just by the number that you're doing. We don't see a difference. We actually see the more adverse reactions in adults and children above 11, but they do happen in infants. But again, that's what we're doing. We're creating, if we're to do this, we are creating an increased risk. This would be a deviation of standard of care that is issued and used across the United States. Again, the evidence. What evidence do we have that this will benefit? We don't have a lot of data on it, while other vaccines and all of them are researched. And I know some individuals do have challenges and they disagree with those, but there is significant numbers. If we're looking at those numbers, we are looking at the adverse reactions that are 0.00 some percentage. It was argued with COVID. Why are we having a pandemic when it's only 0.003% of the population that might die from it or be infected? Well, we're having that same discussion here. And so that would have to be recognized as well. It's just on those points. Do we make a change for one adverse case? And if we did it, and following this forward, would our medical director or any medical director or healthcare provider say, yes, I'll sign off on this alternative? They would then be under that same liability. I don't know if a medical director or healthcare provider would provide that to us. And then again, healthcare professional ethical choice. You will, in changing this, if it goes outside the standard of care and recommendation, our nurses would be placed in a very precarious predicament, where many might say, I will not do that because of my ethical standards. That just has to be recognized. If it does go forward, I would say it would be a required ordinance to put in on the difference on those points for those things. And so those are considerations on those points. So at this time, then go ahead and, with all that additional information and those points that we talked on, just go ahead and open it up to discussion on those points and any other points that I brought up that you wanted to discuss or refute or challenge or anything to the effects. We're willing to have this discussion. So.
Okay, but thank you, Dr. Kingsley. I think all of our questions have been answered through the presentation, and I think this is going to be very eye-opening to the Board of Supervisors when you present it at the next board meeting, I believe, is when it's scheduled.
Well, not this next one, but it'll be the second one in March.
The second one in
Yes.
March. So do we need a motion?
Madam Chair, I have a question.
Okay, go ahead.
It's really not so much a question as a clarification. And Dr. Kingsley did an excellent job on this presentation, and I agree totally with what he's saying. With regard to his presentation on Arizona County Insurance Pool's communication, I was aware of that communication and had a discussion with Director Dorner prior to this meeting, and in full agreement with what's stated there. But to elaborate it a little bit, one thing that wasn't touched upon in that statement was that, as Dr. Kingsley stated, if the county was to adopt a change where we just offered exclusively the extended vaccinations instead of offering them all at once as recommended in the CDC and the Pediatric Association guidelines, as Dr. Kingsley stated, it would open us up to potential liability. If we were either to just offer that as the only alternative, or if we were to offer both alternatives and recommended to parents that they take the extended one, that would also open us up to liability. And what was not stated in the ACIP's response, because probably it wasn't asked, was if the county was sued as a result of something that occurred in that period, in the example that Dr. Kingsley indicated with the extended vaccination, and a child was exposed to a disease during that period and ended up passing away or having severe health issues, the county could be sued. And because we were following a procedure that differed from the standard of care utilized nationwide and recommended by the CDC and the Pediatric Association, the chances are good that we would lose that case. And it's almost certain, and I speak from 7 years of experience in working directly with ACIP and as an alternate board member for ACIP, it's almost certain that ACIP's insurance would not cover the county for any losses. So if you had millions of dollars awarded in a lawsuit, that would come out of the county budget. So I just wanted to clarify that. Not so much a question, but just a comment based on my own personal experience, that I don't think that's a road we want to go down.
I agree. Once you change the standard of care, what's recommended, then you're kind of on an island
I have a
when it
question.
comes to legal liability.
Lynn, you mentioned that we have option to the board supervisor question about the bunch up. Can we do have a little bit of leeway to stagger some of those vaccination out? You mentioned that at one point.
Yeah, go ahead.
The parents have the option.
Right.
They come in sometimes and ask if they can do
Yes.
that.
And from the healthcare provider standpoint, we do have leeway, have a little bit of, option to do that. Of course, not deviate so far from the manufacturer recommendation. So I think that is a useful information for the parent sometime. I think it was bunched up because originally the vaccine was designed for convenience, and that's how it was done, and also the effectiveness of the therapy. So as long as we don't deviate outside of the recommended interval from the manufacturer, we can move around. And you mentioned that. I'm glad that we have that option for parents. Yeah. And my last question I have is,
Dr. Rendon, can I comment on that?
Sure. Yes, please.
So I just say also on that point is, are we trying to fix something that isn't broken? So right now it rests with parents. Is there an availability to do an alternative schedule? Yes, it is. But that's the parent's choice. We're removed from liability when the parent signs that and says, no, I'm going to set up my own alternative schedule. So is there already an alternative schedule available? Yes, there is. And would this be considered government overstep? Is the government stepping in to tell you to do something when the parent is the ultimate choice? So does that already exist there? It does. So are we creating kind of an overstep on a point too? So I just wanted to point that out. So
Right.
thank you.
I don't think we have to change anything in our practice that we are currently have, because that's an option, and it's come down to I see your point here. It's very important. It's voluntary, responsibility, choice, and inform. And inform is so important. So the parent need to be informed, and I think the primary care, the private care physician, I would love to work closely with the private physician in situation where we can work with our nursing staff, and I myself can chat and discuss with the individual patient involvement. I think that's ultimately is the cohesiveness of healthcare. You know?
And I would say identifying those areas for quality improvement. Can nurses definitely at certain times ask more key questions that would prompt, do you feel informed about this, and can we proceed? You know, and can we take extra steps, small extra steps? Yeah, we can.
Yeah,
So
and
that's
we
a great
encourage-
point, and improve communication.
Right, and we encourage parents to discuss with their primary care provider, and I myself will be available to discuss with primary care provider along with the three-way. Right now, technology allowed us to provide three-way conversation easily.
Yeah.
So inform. That's ultimately come down to.
Okay.
Thank you.
Anyone else?
I'm hoping that I was not paying attention when you covered this, because I was aware that, the funds for this come from, the immunization services grant. And if we don't have that grant, that the county taxpayers are going to pick it up. The question I had was, were we given an opinion by staff, by legal staff, as to whether that grant would be affected by the actions that we're considering here?
I don't believe Tingway had the opportunity to look at the contract, but what we can do, with that question, we can have Tingway look at it. I verified on the ADHS side, and their legal counsel looked at it, but we will have our legal counsel look at that contract as well then, and provide that to the Board of Supervisors, any information.
Good.
Is it?
Okay, do we need a motion to present this to the Board of Supervisors?
Yes. So I would, yes, entertain a motion from the board and in what direction and what guidance you'd provide to the Board of Supervisors, yes.
Okay.
You want to make the motion? Okay. I move that your conclusions of your study, as directed by the Board of Supervisors, be presented to the Board of Supervisors. And I don't know whether that would be just where you want to word it for their approval, or just present it to them for further action.
I think Tingway has.
If we do have a specific course of action, we have to make a motion. But however, if it's just a report,
So I would say if there's a recommendation I would say part of the motion would be to enter and to present this presentation to the Board of Supervisors, and we recommend that either an alternative schedule be followed, or that current standard of practice be continued, something to that effect. So I think the Board of Supervisors would appreciate a direction from the Board of Health on that, on which way to take, if they should do an alternative, or if we should keep it as is the standard of care that's currently being practiced.
So my thought on that is, per the discussion that we just held, that we're on solid legal foundation to keep things the standard of care as they are now. So that would be my recommendation.
So Byron, I don't know if you want to, on any of those points, to amend or to add to your motion.
I recommend that the County Board of Supervisors be, let me see if I want to word this correctly. I recommend that, or I make a motion that it be reported to the County Board of Supervisors that it is the opinion of the County Health Board that no action be taken to change the current procedures, vaccination procedures as currently in place by the Mojave County Public Health Department. Would that be reasonable?
I'll ask counsel on that.
I think we may want to add why we feel that way. I mean, obviously, Dr. Kingsley, you're going to be presenting, but they need to know that we are fully aware of the reasons for deciding not to change protocol. which include the items that we've discussed, insurance. And that doesn't mean that we don't review what happens daily at our clinics.
We could, go ahead.
So basically, it will show on the meeting orders about why the board
Okay.
came to that conclusion. But this motion is just to a specific conclusion motion about what these boards recommend the supervisors to do.
Okay, thank you.
So we do have a motion on the floor. Did you want to amend your motion? Are you happy with
If-
what?
If we're happy with it as it is, I mean, unless you just wanted to amend it that, you know, something to the effect and based on a thorough review of all the aspects of the situation. And, you know, whether you wanted to just include that, I mean, it should be obvious that we did do that.
Yep.
So I don't know whether we really need to include that in the motion or not.
Okay, we have a motion and a second. Any further discussion? All those in favor indicate by saying aye.
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 Any opposed? Okay, thank you. Motion passes, and we look forward to your presentation at the Board of Supervisors.
Thank you. And that will be on, just for note, that will be on March.
March 2nd.
Amber, can you help me, or March, not March 2nd, but March, just for clarification. That's the second March. The second Monday in March.
That would be the 18th.
So March 18th will be the Board of Supervisors that will present this at. Thank you.
Okay, motion to adjourn, or we are adjourned.